Bismillah ar-Rahman ar-Rahim. Hello, my friends and my colleagues and my students and my fans everywhere. This is Professor Dr. Tarek Ali. Today I have broadcasted in live video four presentations, four episodes about fever in clinical practice. I just wanted to highlight some issues in the fever in clinical practice about the definition of fever, the significance of fever in clinical practice, the normal physiology of temperature regulation by the hypothalamus, the thermoregulatory system complex of the brain. I already talked about the causes of fever in clinical practice, the acute febrile illness and chronic and recurrent fever, what we call pyrexia of unknown origin. I talked about the pathogenesis of fever, and I talked about the pathophysiology of fever and management of fever. And I explained the difference between the pathogenesis of acute febrile illness and the versus the pathogenesis of conditions and causes of fever of unknown origin. I mentioned the different pharmacological and physiological and psychological or mental causes of fever, and then I talked about the pathological causes of fever, which constitutes most of the febrile presentations in clinical practice. And I already explained that the respiratory viral infections, although they are the commonest causes of fever in most cases of fever presenting in clinical practice, specifically and generally infections constitute the most important cause of fever in clinical practice. But we should not forget other pathological processes, including the inflammatory disease, the autoimmune inflammatory disease, connective tissue disorders causing fevers like lupus, like mixed connective tissue disease, like some vasculitic syndromes, and the other autoimmune systemic inflammatory conditions which present with fever of inflammatory origin. And then I already talked also about endocrine and metabolic causes of fever of unknown origin. And this is very important category: endocrine causes of fever, metabolic causes of fever, and neoplastic causes of fever, that is tumors, malignancies, and fever. What are the malignancies which might cause fever? And this is the most common paraneoplastic non-metastatic manifestation of malignancy in general: fever and loss of weight. And I talked about the other commonly forgotten causes of fever, because most of the physicians and the clinicians are focusing on pathology, clinical disease, and they forget that there are what we call drug-induced fever. So drug-induced fever is a very important category, and these pharmacological causes of fever. And it is a very broad spectrum of mechanisms. Drug-induced fever. Don't forget about drugs, and to ask about drugs in detail. Drug history is important in the evaluation of any patient presenting with fever in clinical practice. Ask about drugs. Ask about also other external environmental causes: physical, exposure to sun, exposure to abnormal heat. This might affect the body and cause fever. Of course, the most common is the sunstroke and heat exhaustion and malignant hyperthermia. And don't forget to ask about insects and insect bites, exposure of the individual to bites by insects or by snakes or scorpions or spiders or unknown animals and insects in the environment around him, especially in special places like in villages and those practicing in rural areas. So insects and animals might cause fever. Also, exposure to chemicals and irradiation and toxins and fumes also cause fever. Substance abusers who are abusing substances can cause fever of CNS origin. This is substance abuse fever. So toxins, chemicals, substances abused, drugs, etc., they might all cause fever. So don't forget to ask in detail about these environmental factors causing fever. These are in many cases physiologic, and drugs, and these are pathologic, and these are pharmacologic causes of fever. And then proceed to ask about the pathological causes of fever. Also, don't forget in the history to ask about, very important, sexual history in detail, because venereal diseases or sexually transmitted diseases, or the STDs, constitute an important bulk of diseases among infections causing fever in clinical practice, whether acute fever or chronic and recurrent fever. So don't forget to ask in detail about sexual history in clinical evaluation while you are taking history from the patients in the patient's interview. So this is all very important. Don't forget that the causes of fever are too much, and there are a large number of diseases grouped under different headings which can cause fever, ranging from infectious to inflammatory to endocrine and connective tissue diseases and metabolic diseases to neoplastic disorders, and drugs and environmental factors, as I mentioned. So this is all very important while you evaluate a case, or you clinically assess a case of fever in clinical practice. Asking about the magnitude and the pattern of fever is very important, because we have different patterns or types of fever: the continuous or sustained, the intermittent, the remittent, the hectic, and the relapsing fevers. These are all patterns of fever which might point to the possible underlying cause. Some of the causes of fever in clinical practice, they do not need specific medical treatment, they resolve by themselves. And some other causes of fever in clinical practice need to be identified and treated specifically, and they should be subject to thorough clinical evaluation, investigations, including laboratory investigations and the radiologic investigation, to reach to the exact and definite cause and the definite diagnosis in order to treat the fever. Because fever is a manifestation, we have to treat the cause of the fever. This is the most important issue in the management of fever. Treatment of the underlying cause, to recognize the underlying cause, to address the underlying cause. Is it infection, and what type of infection? Is it neoplasm? Is it endocrine disease? Is it inflammatory disease? Is it autoimmune disease? Is it insect bite? Is it drug? Stop drugs which might be plained, please. And this is the number one and the most important step in the management of the fever. Treatment of the cause, and then symptomatic treatment with antibiotics, like simple antibiotics, simple analgesics, especially that the fever in many cases are associated with pain. So we give such pain relievers or simple analgesics like paracetamol or acetaminophen, Tylenol. Or we can use non-steroidal anti-inflammatory drugs. Most commonly we use ibuprofen or naproxen only. No need to use diclofenac. Diclofenac is potentially hepatotoxic, so don't abuse using it too much in clinical practice. Diclofenac, like Voltaren, for example, it is hepatotoxic, remember this. So we most commonly use, after paracetamol, the ibuprofen and the naproxen. We can use other, of course, antibiotic measures. The patient should drink a lot of fluids, water, fruit juices, and get away from exposure to cold too much. And because this is sometimes not useful in patients with fever, except if there is high fever. In high fevers and hyperparexic conditions, we might even put the patient in an ice or cold tub. So this is the simple measures to relieve fever, but the most important is to address the underlying cause of fever and treat the underlying cause of fever. Thank you so much. Have a nice day.